everyone, my name is Jacqueline and today we were discussing person-centered therapy. Carl Rogers, father of person-centered therapy. He was born January 8, 1902 in Illinois, USA, and he died February 4, 1987. He's American. His field is psychology. Although he's known working on education, he's one of the founder of humanistic psychology. He coined the term person-centered therapy. The core conditions: empathy, trying to see and feel of someone feeling. It means entering the private perceptual world of the other and becoming truly at home in it. It involves being sensitive, moment to moment, to the changing felt meaning which flown in the other person, to the fear or rage or tenderness or confusion or whatever he or she is experiencing. It means temporarily living in the other lives, moving about its delicate without making judgment. Congruence, best described as being genuine. The congruent person is genuine, real, integrated, whole, and transparent. The non-congruent person tries to impress, play a role, puts up a front, and hides. Rogers realized that congruence between feelings and action can never be total, but his experience convinced him that choosing to be real with others is the single most important decision a person can make. Unconditional positive regard or non-judgmental attitude. Unconditional positive regard is the label given to the fundamental attitude of the person-centered counselor toward her client. The counselor who holds this attitude deeply values the humanity of her client and is not deflected in that valuing by any particular client behavior. The attitude manifests itself in the counselor consistent acceptance of and enduring warmth towards her client. Person-centered therapy goals and technique. Let's imagine an acorn falling on an oak tree. This acorn has the potential to become a mighty oak tree itself. Given appropriate condition, it will automatically grow and accomplish the outcome. People like an acorn also seek to continuing growth in a positive way. This idea of striving toward realization, fulfillment, autonomy, self-determination, and perfection is prepared to actualizing tendency. This idea is essential to a process to a person-centered therapy. Person-centered therapy is a non-directive form of talk therapy with a positive view of human nature. This also sometimes referred as a client-centered therapy. Person-centered therapy is based on a positive belief that the individual has the inherent capacity to move toward the stage of positive mental health. Much like an acorn has the inherent capacity to become an oak tree. Before we discuss this further, let's remember that person-centered therapy is based on the idea that a person will create their own self-growth given the appropriate circumstances. Think back to the acorn metaphor. Imagine a squirrel comes along and buries an acorn. The acorn now buried in a nutrient-giving soil that needs to grow into an oak tree. The counselor in the person-centered therapy is much like the squirrel, providing a nurturing environment and much a person can reach their inherent potential. This means the counselor does not control the therapeutic environment, interpret the client behavior, or evaluate their decision. Instead, they are to provide a positive environment for their client to experience the growth that they are capable of. In person-centered therapy, the focus is on the person, not in the problem. Goal and technique. The goal is for the client to achieve greater independence. This allows the client to better cope in any current and future problem that may face. There are 4 basic goals. A person achieves a successful person-centered therapy. They may become open to experience, learn to trust themselves, develop an internal evaluation of themselves, and have the willingness to continue growing. The primary technique involved in person-centered therapy is reflection. Put simply, this is a restatement of what the client says. Reflection, when practiced properly, we shown understanding the client's situation and display empathy. However, person-centered therapy does not rely on techniques or formal assessment. Instead, the quality of the therapeutic relationship is considered the most important factor. A counselor's ability to establish a strong connection with their client is a critical factor in the success of person-centered therapy. Remember the acorn metaphor? The client is the acorn and the counselor is the squirrel. The strong relationship between the counselor and client is the nutrient-rich soil where the squirrel buries the acorn. The counselor relationship with the client nurture their successful psychological growth, just like the soil nurture the acorn until become the oak tree. One of the main advantages of person-centered therapy is cross-cultural application. Person-centered therapy has a global impact and has been adopted in many pit cultures around the world.